Hello, this is Dr. Frances Pitzilis. What questions should you ask before undertaking female hormone replacement therapy? Now, what's important about this is weighing up the potential benefits and the potential risks and looking at that individual person's risk profile and whether it's really a good idea or not. Now, firstly, why would you take any hormones? Well, usually it's either because you're young and you've just had a hysterectomy or you've had an early menopause, or you're going through the menopause or past the menopause and you've had significant symptoms. Now, the significant symptoms of menopause may include disabling hot flushes that keep you awake at night. You might get crawling feelings that doctors call formications, and you might get anxious and depressed and fatigue and you don't sleep. So when these symptoms are serious enough, you've got to weigh up the risks and the benefits. However, before you consider hormones, you can actually try some herbs, evening primrose oil, St. John's wort. You could look at black cohosh, and you could look at other herbs and even medical treatments like antidepressant therapy. Some of the antidepressants actually reduce hot flushes, so that could be useful, particularly if you're worried about your risk of breast cancer. What are the current international recommendations for hormone replacement therapy? Experts tell us that you should always assess that person's risk of breast cancer first. Then, if you feel satisfied that the risk is low, then it would be reasonable to consider hormone replacement therapy, but only a specific type of hormone replacement therapy. And if you do it, we have information that tells us that if you start your hormone replacement therapy within the 10-year window of menopause and you take it for 5 years, your risk of heart attack, stroke and dementia are reduced. So that's interesting, isn't it? Now, the type of hormone replacement therapy that is recommended is estrogen that is given through the skin. This means that you use patches or gels or creams. Now, the manufactured drug company estrogens that are used through the skin are actually bioidentical. So that's something that we know. Now, the other component of your hormone replacement therapy is that if you're going to use progesterone, it should be the micronized progesterone, which is bioidentical, the same as in your own body. This is because the studies have shown that the other synthetic progestins have more problems associated with them. For example, in 2002, when everybody found out that there was an increased risk of breast cancer associated with one of the synthetic progestins, a lot of women around the world were stopping their hormone replacement therapy. Since then, they've discovered that micronized progesterone has a very minimal side effect profile, and it's good for the heart, and it's neutral, we think, for the breast. Many people ask about bioidentical hormones. Bioidentical hormones are made by a compounding pharmacist, and the other hormones that are made by drug companies are also bioidentical, and they're made by drug companies. So the terminology can be quite confusing, and you think that because you're having a bioidentical hormone that it might be safer, but not necessarily so. I think you have to be suitable for the treatment, and it has to be prescribed carefully for that person, and it still must be estrogen through the skin and micronized progesterone. And overall, the risk must be looked at.